let us look at the PV loop and then that this is associated. Okay, now we have initial point, starting point, where MV is open. It will pump out the blood. Then MV closes. Aortic valve is still closed, but pressure increases, isovolumetric contraction. At this point, AV valve is open. Blood is ejected out. Now AV valve closes. Still MV is closed. Pressure decreases, isovolumetric relaxation. Now the point of least volume filled is end systolic volume. Maximum attained volume is end diastolic volume. In between you will have stroke volume. The area under curve gives stroke work, and the graph drawn along lower will be end diastolic pressure volume relationship. The slope will be end systolic pressure volume relationship, denoting the preload and contractility respectively. In other terms, diastolic function and systolic function of heart. So this was a normal physiological. Pathological changes we are going to see now. So as we know, this is end diastolic pressure volume relationship. This will give end systolic pressure volume relationship. If the compliance is decreased, with the maintained contractility, this denotes diastolic heart failure. If drawing the same curve, compliance and contractility. If contractility is reduced, maintaining compliance, then you have systolic heart failure. Coming to valvular pathology and how to identify it on pressure volume loops. So we know there can be regurgitant or stenotic lesions of valve. It can be AR, MR, AS and MS. Drawing the normal loop, this denotes end diastolic volume, right, and this denotes after load. So in non-regurgitant lesions you will have increased end diastolic volume. Okay, graph might look somewhat like this, or it might also look somewhat like this. In both the cases, EDV is increased, but afterload increased only with the cases which affects aortic valve. So you have two graphs here, the blue one denoting MR and the white line denoting AR. You learned about regurgitant lesions. So stenotic lesions will have decreased end diastolic volume, or it may be maintained in some cases. That is, the graph might look like this with maintained end diastolic volume but increased after load. Therefore it will be AES. But if it is decreased, the decrease in afterload, it will be MS. So you have to look into two things in total, whether end diastolic volume is increased decreased, and after load is increased or decreased. A trick here, all end diastolic volume will be increased in recadent lesions, therefore contrary decreased in stenotic lesions. Now after load will be increased in aortic lesions, EA. The other thing will be MM. This is all you need to know.